It is time for another edition of Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Good morning, Dave.
Yeah, another beautiful day out there. Good day for grounding. That can get done, and good day to get some vitamin D. But we're going to talk about ozone today.
Absolutely. So, we've been utilizing this treatment for about 4 months now, and every day it's absolutely just boggling my mind how broad the application is for ozone therapy. And everybody is beginning to hear about hyperbaric therapy over the last few years. That's spreading around, and you've got RFK Jr. talking about it, and so that's a hugely powerful tool that we offer here at the Okoboji Wellness Clinic, and has helped so many people with chronic pain and inflammation. But we want to have tools in the tool belt because sometimes one thing works better than the other thing. And ozone is something that it's been around a long time, but people are still not all that familiar with it. It's not many doctors' offices offer this therapy, Dave.
Yeah, and this is really cool because, like you say, it has a very wide application. And if you would, you might just tell us some of the things that you've been using it for, because I know some of the stories are pretty remarkable.
They are. They're absolutely remarkable. So as it applies to energy and brain fog and joint pain, those are some of the big ones. And, one question a lot of times I get is, well, why isn't this offered, in more places? And it's because you can't patent Mother Nature. Ozone it's 3 oxygen molecules, and that is something that you cannot, pharmaceutical companies, they try to mimic things that are in the environment. Let's say ivermectin came from avermectin in the soil, and so they change a few changes, and then they can patent it and make money off of it. You can't do that with ozone. And ozone is naturally produced in the body. It is already something out in nature. When there's lightning strike, ozone is produced, and the application of it, again, it's in a gaseous form, and so we've got an ozone generator that we use, and we can apply this to multiple approaches to help the body. We've talked a little bit about how the body, as we age, think of our body as a flashlight that starts to dim.
Mm-hmm.
That's our mitochondria. That's the things that make energy, or ATP, in our body. So what can we do to supercharge that battery? And ozone is one application of that to brighten that battery. And so once we apply that, again, multiple applications through the IV, where folks will come in for an hour treatment once or twice a week and supercharge. 10 to 15 treatments is pretty standard. And for that IV therapy, and again, about an hour treatment where we take some blood and put some ozone gas in and then inject that back in. And it's a very seamless process. And again, each treatment builds on itself. But when we talk to joints, and we talk about chronic pain then can affect sleep, and it can affect mood. If you think about your hands, for instance, when they're working, you don't really think too much about those hands. But when they're not working, when they're stiff, when you've got a trigger finger, that's where that finger kind of gets stuck. It almost can't extend it out. When you get carpal tunnel, when all of a sudden, my hands are numb, and I'm losing some feeling in there, and I'm losing some strength in there. Many times, folks are bypassing this incredible therapy and going straight to surgery. And many times, what I'm finding is, even in some pretty significantly advanced cases, whether or not it's degenerative changes in the shoulder, knee. I have one gal that she was close to bone on bone in that knee, and really has a lot of medical risk factors, wanting to avoid surgery for that reason. She's had an incredible response. I have another gal that's coming up from central Iowa, and for another same thing, knees nearly bone on bone. She runs a bed and breakfast down there, and really, really active, and she's on her way to Scotland coming up here real soon. But she is just ecstatic right now with her response to this therapy. And again, it's not a steroid. It is literally, we put in a little precursor solution in some cases, which includes procaine, and kind of gets that tissue ready for a follow of ozone that's put into that joint space. Many times folks need anywhere from 2 to 3 to 6 of these treatments, and what's so phenomenal about it, and this type of treatment is called Prolozone. My friend Dr. Frank Schallenberger out in Nevada came up with this treatment and technique, and it is something that it's the solution that we put in before the ozone. But what's so phenomenal about it is many times long-standing pain, whether it's back pain, neck pain, shoulder pain, knee pain, hand arthritis. I can't cook at night. I can't grip. It's too painful. There's not enough strength in there. These things, you start to utilize this treatment. You can, in some cases, I've seen folks get to near complete resolution of pain. In some cases, completely pain-free. That for some of these people, it lasts indefinitely. And so other folks, they maybe tweak that joint again, irritate it, and then they need to come in for a booster once in a while after 3 to 6 injections. But specifically, even in that hand, such an easy treatment for carpal tunnel. What we do is, again, I just go barely under the skin, put that in there, and the sensation with that ozone in there lasts about anywhere from 3 to 5 minutes, and then gone. These treatments compile upon each other. The other really cool thing, Dave, is for the hand arthritis. So what we do with that is it's called gamma, is the concentration. And so I would do about 7 gamma in many cases in each digit. And so the fingers, when I put a little bit of this ozone in each finger, they swell up temporarily. They look like little sausages. Then that goes away over the course of the next couple hours. And, boy, we do 2 to 3 of those treatments, and phenomenal improvement in pain. Again, to the point where you're not thinking about your hand until you can't use it, or whatever that joint may be, and thinking, well, I just got to take my meloxicam, or I got to take my ibuprofen and just kind of mask that pain. The beautiful thing about this is it's a solution that's not only decreasing inflammation, but it's stimulating stem cells. It's increasing oxygen flow to that tissue. It's turning on and off the right inflammatory markers. So it's just a very elegant way to go about helping the body get into that healing zone.
We have, since the beginning, have been talking about inflammation, and really you've talked about peeling the layers of the onion back to get at the root cause. But whatever the root cause is found out to be, you certainly have uncovered the fact that if we're going to have success healing disease, nearly all of it seems to be inflammation in some sort that we need to get control of.
And doing that, we do that by increasing metabolism. And there's a whole host of ways of doing that, and we also identify what is inflaming. So it's a two-way street. You know, if somebody is not sleeping at night very well, they've got brain fog, and they've got pain, we got to work on those. Those are some of my top measures to work on to bring that down, get you feeling better. In the meantime, we go on this detective hunt to identify what your body's missing, what are the toxins we're being exposed to over our lifetime, and how do we get those out of our body. In the meantime, if we can feel better in the process, sleep better at night, less pain, more mental clarity, that helps the mood, that helps the healing. and then everything we do works all that much better.
And it's amazing the tools that are available. This ozone therapy available now, the hyperbaric therapy, red light therapy, and it just goes on and on. And people are discovering, and it's not like you brought up ivermectin, it's not just the therapies that we're talking about here. We're talking about repurposed drugs that have been around for 40, 50 years that people are having amazing success with little side effects. People, since the advent of COVID, they have gone on a discovery mission to where they're actually practicing medicine.
Absolutely, and it's a discovery for the individual trying to learn more and have that discussion with me on these visits. It's a two-way street, and I was listening to. There's a group of integrative physicians who are MDs and DOs that were trained traditionally, and more traditionally trained doctors are kind of going into this realm where we're utilizing the best of both worlds. And it was over lunch yesterday, this one gentleman was like, wait a second, why didn't I learn this in medical school? And again, that's the question that once some of us that have gone into this more integrative care model where we're using the best of both worlds, the more holistic stuff, and then the repurposed drugs like you talk about, the right prescriptions at the right time. Sometimes those things are needed. It's a balance, and it's an exciting time that we're in right now because I think there's such an appetite for a different way because a lot of folks, again, end up spinning their wheels and they're not having an improved quality of life when they're doing nothing but pharmaceuticals and not making the lifestyle changes or working on, quote unquote, improving that metabolism and recharging the battery.
Yeah, it is an exciting time. There's a big amount of changes that are happening. The thing I like maybe more than anything is people are honestly, they're becoming their own advocate. They're coming to you and saying, this is kind of the road I'd like to go down. What do you think about that?
Yes, informed consent. My job is to have a conversation, share what I know, and listen to what the individual coming in to me has learned, and we come up with a plan together that makes sense, and because ultimately it's the journey that you are on as the guests that come in, and I can make all the recommendations, but until the individual's ready to make those next steps, some folks go at a really fast pace, and other folks they prefer to take it more slowly, and they're not all in yet, and that's okay, because it's a process of how am I going to integrate all of these different ideas into something that works best for me. And that's what we're about, is I want you to have quality, I want you to have longevity, and I want you to feel comfortable with the plan that you're on. It shouldn't be something that's forced upon you. It should be something that you feel good about yourself.
So we're out of time. What I'd like to tackle down the road about ozone is more on the brain fog, the mental clarity, and how it helps that, because that's pretty significant for a lot of folks as well. But this today, talking about how it tames inflammation and things like that, pretty amazing. All right, so
it is. I tell you, Dave, one last hope story is I had a gal that came last fall. There was some a COVID vaccine injury that was, I think, part of the equation, but she was in really sideways, lots of fatigue, brain fog, lack of physical stamina, history of seizures after she'd been exposed to different things, and one of them which was, again, the COVID vaccine. She developed all these symptoms subsequently thereafter. She came in at about a 2 out of a 10 with where she would rate her overall quality. And she was in just recently. She's been down the road over 60 hyperbaric treatments. She's done ISS neurofeedback, and she's worked with IV Ozone, and she said she is right now at about an 8.5 out of 10. So that's over the course of about 6 months, a remarkable change for her. Her physical stamina's back. She's got a brand new outlook in life for somebody that was, in her, I think, 20s or early 30s, and thinking, what does my life look like if it's sitting at a 2 out of 10 all day long and every day? So there is hope for those out there that are not feeling where they want to feel, and we want to help you.
Awesome. All right, so how can people get a hold of you? How can they have one of those Wellness Wednesday investigative calls with you?
Yeah, just give us a call at 712-339-6024, and we'll do a 15-minute discovery call to just chat a bit and see, answer a few questions and get you started on your road to balance, wellness, and high-quality life and longevity. We're at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. And so we got a great team, compassionate and passionate folks that really care about getting you to feeling your best.
Very good. Dr. Meyer, always a great pleasure. Have a great day, and we'll chat again soon.
Thanks, Dave. Be well, everyone.
Thank you very much. Dr. Bradley Meyer at the Okoboji Wellness Clinic. Can find out more, OkobojiWellnessClinic.com.